Hello and welcome to the ID Talk podcast. My name is Peter Counter and I am the editor-in-chief of FindBiometrics and Mobile ID World, where we are venturing forth into the world once again for a jam-packed industry event season. Last week, our Director of Digital Media and Events, Doug OGorden, was in Orlando to check out the world of healthcare at HIMSS. And that's where he met up with Jay Sultan, Vice President of Healthcare Strategy at LexisNexis Risk Solutions. They talk about the importance of identity in healthcare and the role of consent around data sharing in patient care before digging into LexisNexis's approach to identity resolution and biometrics. They finish off the conversation with some practical lessons about biometrics in clinics and hospitals and a vision of the future for identity in healthcare. It's a great window into a market that is really direly in need of biometrics and identity solutions. So without further ado, here is LexisNexis Risk Solutions' Jay Sultan in conversation with our own Doug OGorden, recorded live at HIMSS 2022.
Hi, FindBiometrics listeners. Doug OGorden here with Jay Sultan, VP of Healthcare Strategy at LexisNexis Risk Solutions. How are you, Jay?
I'm really well, thank you, and I appreciate having a chance to talk to your listeners.
Yeah, and thanks for being at the show. We're at HIMSS 2022, live from HIMSS 2022, and had a couple questions for you. One of them was, how does identity management fit in the larger landscape of healthcare and the future of healthcare? Particularly the identity verification and patient consent.
You know, it's a really important area. In healthcare today, a person doesn't exist as an identity. If you're in a hospital, you exist as a chart. And if you go to the hospital 10 times, you have 10 charts. And of course, you have a patient ID, but for most hospitals, it's very difficult to manage the patient IDs to make sure that all of your data is seen and collected together, and that your identity is seen as one person, as opposed to a series of member IDs and member charts. Same thing with an insurance company. You're an enrollment to the insurance company. And if you get insurance and change insurance and go back, these are all multiple enrollments from an insurance company perspective. We as people with identity, we need to have our systems that are used in healthcare actually become patient-centric. Patient centricity is a buzzword in healthcare. It says don't think about the doctor, don't think about the care plan, think about the patient and what the patient needs. But because identity is such a challenging concept in healthcare, where we don't use social security number to disambiguate people, we use name and address, and it's really hard. It's usually very difficult. It especially gets into concepts like consent. Now, as a patient, you have to give consent for all kinds of things. You have to give consent to have a procedure done. You have to give consent to have your insurance charged. One of the more important things in the future is going to be getting consent around the ability to have your data shared. There's new laws that are just now coming into effect that insurance companies and hospitals and doctors have to use, whereby you can move your data around or get access to your data with the concept of consent. And so we're going to see people move more and more towards digital forms of consent authorization, and for that matter, digital forms of identity, both identity verification, kind of identity proofing, as well as even the concept of my identity being represented in a digital way rather than my name and my address or my member ID or something like that.
For sure. How does LexisNexis Risk Solutions help healthcare organizations with identity management? How do you integrate identity solutions for your providers, payers? What do you do today?
Yeah, we have an enormous amount of work that we do today, both in and out of healthcare, whereby we're providing identity resolution, and we do so in a means very differently than others. Others use algorithms and try to predict that a Jay Sultan spelled one way on Main Street and a Jay Sultan spelled another way on Oak Street are the same person or not. We don't do that. We actually have referential data that knows both of those names and both of those addresses, where we can say with a 99.99% certainty that the data we've matched is in fact for Jay Sultan, the one only Jay Sultan we have in mind. So we have the identity resolution capability. We have identity. We also have the identity proofing capability. inside of healthcare and especially outside of healthcare, LexisNexis solutions are used to verify that you are who you say you are and to prevent bad actors and fraudulent activity happening in your name on both a human basis as well as a device basis through our work with a solution called FindBiometrics. So it's a profound capability.
Awesome. We did mention a little bit about how you're using biometrics, but it's more identity. What is the best example of how LexisNexis Risk Solutions is using a form of biometric?
Again, I think our ability to detect a device and understand the identity of a device and to know the difference between your actual phone and something that's trying to spoof your phone is probably the best example. Now, we have a solution called True ID, where it's you're able to take a picture of a government-issued ID and then take a selfie, and then we can evaluate that the government-issued ID is authentic and that the person in the selfie matches the person on the government ID. So there are examples of biometrics, but the favorite story I want to tell you comes from 10 years ago when I was a volunteer working as a consultant with a hospital in a very, very remote part of Africa, a country called Central African Republic. Now, this hospital is literally what you think of when you think about rural Africa. Dirt floors, thatched roof huts, tons of disease, no resources, etc. And they had a problem that people would come and they would want to get care, but they still owed a bill from their previous visit. So they would just give a different name. There's no photo IDs there. People walk for 2 days to get to this hospital. So it's like you would know people in your community kind of thing. So to help this hospital solve the problem, we took out little $20 fingerprint scanners, just a tiny little 2 inches tall fingerprint scanners that they could use. And when a person would come to register in the hospital, they would use their fingerprint, not to confirm who they were. Again, there's no government registry of identity or anything like that. They used it to say, I've seen you before, and in fact, you do have a bill. Let's talk about getting your bill paid as part of getting your care. So, today, you translate that to, well, what is the U.S.? What is the relevance to the U.S. experience? We see companies like Clear, for example, continuing to work with organizations that want to have kiosks for automated registration and automated check-in. I think in the future, as we see more and more people using telehealth and telemedicine capabilities, today I could take my phone, and I've got group, commercial insurance through my employer. I could go down to the free clinic in my community where I volunteer, and I could just simply hand the phone to everybody in. I could log in, tell them you're Jay Sultan, talk to this doctor, hang up, go to the next person in line, tell them you're Jay Sultan. We don't have the same kind of authentication and identity proofing in the virtual world of healthcare yet as we have in the physical world. Mm-hmm. So I do believe that biometric and other capabilities are going to be really, digital identity capabilities, are going to be really important as healthcare becomes more digital.
Amen. That's really, I was going to ask you what's the future, and you just told me.
That's the future.
So, hey, thank you, and I hope you have a great show.
Thanks. I appreciate this opportunity again to speak to your listeners.
Awesome.
And so concludes our interview with Jay Sultan, Vice President of Healthcare Strategy for LexisNexis Risk Solutions. To learn more about the topics discussed in this episode, visit LexisNexis.com. And for more spring events coverage, including more HIMSS interviews and live reporting from ISC West, stay posted to FindBiometrics.com. I want to thank Jay for participating in this episode, and thank you to Doug OGorden for conducting the interview. Our podcast theme music is by Logomrad. I have been your host, Peter Counter. Thank you for listening to the ID Talk Podcast.